Welcome to Executive Order Watch.
The immigrants have arrived.
I know. I have the package.
Five, 352. The individual engages in any combination of the activities described in subparagraphs through, for a total of not less than 80 hours. The individual has a monthly income that is not less than the applicable minimum wage requirement under Section 6 of the Fair Labor Standards Act of 1938 multiplied by 80 hours. Mandatory exception for certain individuals. The state shall deem an applicable individual to have demonstrated community engagement under paragraph for a month if, for part or all of such month, the individual was a specified excluded individual as defined in paragraph, or was under the age of 19, pregnant or entitled to postpartum medical assistance. 353. Under paragraph or of subsection, entitled to or enrolled for benefits under Part A of Title XV, or enrolled for benefits under Part B of Title XV, or described in any of subclauses through of subsection, or at any point during the 3-month period ending on the first day of such month, the individual was an inmate of a public institution. Optional exception for short-term hardship events. The state plan may provide, in the case of an applicable individual who experiences a short-term hardship event during a month, that the state shall, upon the request of such individual under procedures established by the state, deem such individual to have demonstrated. 354. Community engagement under paragraph for such month. As term hardship event. For purposes of this subparagraph, an applicable individual experiences a short-term hardship event during a month if, for part or all of such month, such individual receives inpatient hospital services, nursing facility services, services in an intermediate care facility for individuals with intellectual disabilities, inpatient psychiatric hospital services, or such other services as the Secretary determines appropriate. Such individual resides in a county in which there exists an emergency or disaster declared by the President pursuant to the National Emergencies Act or the Robert T. Stafford Disaster Relief and Emergency Assistance Act, or 355. That subject to a request from the state to the Secretary made in such form at such time and containing such information as the Secretary may require, has an unemployment rate that is at or above the lesser of 1, 2, 3, 4, 5, 6, 7, 8%, or 91.5 times the 10 national unemployment rate, 11 or 12 such individual experiences, 13 any other short-term hardship. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. OPN to conduct more frequent compliance verifications. With respect to an applicable individual enrolled in receiving medical assistance under a state plan under this title, the state shall verify that each such individual has met the requirement to demonstrate community engagement under paragraph during each such individual's regularly scheduled redetermination of eligibility, except that state may provide for such verifications more frequently. Ex parte verifications. for purposes of verifying that an applicable individual has met the requirement to demonstrate community engagement under paragraph, the state shall, in accordance with standards established by the Secretary, establish processes and use reliable information available to the state without requiring, where possible, the applicable individual to submit additional information. Procedure in the case of non-compliance. If a state is unable to verify that an applicable individual has met the requirement to demonstrate community engagement under paragraph, including, if applicable, by verifying that such individual was deemed to have demonstrated community engagement under paragraph, the state shall provide such individual with the notice of non-compliance described in subparagraph 357. Provide such individual with a period of 30 calendar days, beginning on the date on which such notice of non-3 compliance is received by the individual 425. Make a satisfactory showing to the state of compliance with such requirement. Or make a satisfactory showing to the state that such requirement does not apply to such individual on the basis that such individual does not meet the definition of applicable individual under paragraph. If such individual is enrolled under the state plan under this title, continue to provide such individual with medical assistance during such 30 calendar day period. And 358. If no such satisfactory showing one is made, and the individual is not a specie 2 excluded individual described in para 3 graph, deny such individuals EP for application for medical assistance under the 5 state plan, or as 6 applicable, disenroll such individual from 7 the plan not later 8 than the end of the month, following the 9 month in which such 30 calendar day PAP10 riot ends, provided that 11. The state first determines whether, with respect to the individual, there is any other basis for eligibility for medical assistance under the state plan or for another insurance affordability program. And the individual is provided written notice and granted an opportunity for a fair hearing in accordance with subsection. The notice of non-compliance provided to an applicable individual under subparagraph shall include information. 359. How such individual may make a satisfactory showing of compliance with such requirement, or make a satisfactory showing that such requirement does not apply to such individual on the basis that such individual does not meet the definition of applicable individual under paragraph. How such individual may reapply for medical assistance under the state plan under this title, in the case that such individual's application is denied, or, as applicable, in the case that such individual is disenrolled from the plan. Treatment of non-compliant individuals in relation to certain other provi. Certain FMAP increases. As State 22 shall not be treated as not providing medical as 23 assistance to all individuals described in Section 24-1902, or as not expending 25. 360. Amounts for all such individuals under the state plan, solely because such an individual is determined ineligible for medical assistance under the state plan on the basis of a failure to meet the requirement to demonstrate community engagement under paragraph. For purposes of Section 36B of the Internal Revenue Code of 1986, an individual shall be deemed to be eligible for minimum essential coverage described in Section 5000A of such code for a month, if such individual would have been eligible for medical assistance under a state plan under this title, but for a failure to meet the requirement to demonstrate community engagement under paragraph. General, in accordance with standards specified by the Secretary, beginning not later than October 1st, 2028, plus 3 months, and period I. 361. Cali thereafter, the state shall notify applicable individuals enrolled under a state plan under this title of the requirement to demonstrate community engagement under this subsection. Such notice shall include information on how to comply with such requirement, including an explanation of the exceptions to such requirement under paragraph and the definition of the term applicable individual under paragraph. The consequences of non-compliance with such requirement, how to report to the state any change in the individual's status that could result in the applicability of an exception under paragraph, or the individual qualifying as a specified excluded individual under paragraph. 362. Form of outreach notice. A notice required under subparagraph shall be delivered by regular mail and in one or more additional forms, which may include telephone, text message, an internet website, other commonly available electronic means, and such other forms as the Secretary determines appropriate. D in this subsection. Applicable individual. I. The term applicable individual means an individual who is eligible to enroll under the state plan under subsection, or who is otherwise eligible to enroll under a. 363. Waiver of such plan that provides coverage that is equivalent to minimum essential coverage of the Internal Revenue Code of 1986, and as determined in accordance with standards prescribed by the Secretary and regulations. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 11, 13, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. Has attained the age of 19 and is under 65 years of age. Is not pregnant, is not entitled to or enrolled for benefits under Part Title X fee, or enrolled for benefits under Part B of Title X fixed fee, and is not otherwise eligible to enroll under such plan. Specified excluded indi. For purposes of clause, the term specified excluded individual means an individual as determined by the state. 364. Who is described in sub 1 section 2, 3 as an Indian, or in 4 urban Indian, and 6 of section 4 of the Indian 7 Healthcare Improvement Act. 8 is a California Indian 9 described in section 809 of 10 such act, or 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Who is medically frail, or 23, otherwise has special medical needs. 24. Has otherwise been determined eligible as an Indian for the Indian Health Service under regulations promulgated by the Secretary. Who is the parent, guardian, or caretaker relative of a disabled individual or a dependent child. Who is a veteran with a disability rated as total under Section 1155 of Title 38, United States Code. 365, include wanting an individual 2 who is blind or disabled. 5 with a substance use 6 disorder. 7 with a disabling men 8 tall disorder. 9 with a physical, intellectual, or developmental dis-11 ability that significantly impairs 12 their ability to perform 1 or more 13 activities of daily living. 14, 15, 16, 17, 18, 19, 20, 21, who 22, 23, 24, 25. With a serious and complex medical condition, subject to the approval of the Secretary, with any other medical condition identified by the state that is not otherwise identified under this clause, is in compliance with any requirements imposed by the state pursuant to Section 407, or 366. Is a member of a household that receives Supplemental Nutrition Assistance Program benefits under the Food and Nutrition Act of 2008 and is not exempt from a work requirement under such act. 1, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, who is an inmate of a 13 public institution, or 14 who meets such other cry 15 criteria as the Secretary determines API 16 appropriate. Educational program. The term 18 educational program means 19. An institution of higher education 20. 22 a program of career and tech 23 NICL education as defined in section 3 of 24. Who is participating in a drug addiction or alcoholic treatment and rehabilitation program and Nutrition Act of 2008. 367. The Carl D. Perkins Career and Technical One Education Act of 2006. Or 2 any other educational program 3 that meets such criteria as the Secretary 4 determines appropriate. S. The term state means one of 6 the 50 states or the District of Columbia. W. York program. The term Work 8 program has the meaning given such term in 9 Section 6 of the Food and Nutrition Act 10 of 2008. 11. P. Prohibiting waiver of Community 12 engagement requirements. Notwithstanding 13 Section 1115, the provisions of this subsection May 14th not be waived. 15. CA, Section 16-1902 of the Social Security Act is amended by striking 18 subject to subsection and in subject to sub-19 sections and 20. Not later than July 1st, 2027, the 21 Secretary of Health Human Services shall promulgate 22 regulations for purposes of carrying out the amendments 23 made by this section. 24. GS 5. 368. I, the Secretary of Health and Human Services shall, out of amounts appropriated under paragraph, award to each state a grant equal to the amount specified in paragraph for such state for purposes of establishing systems necessary to carry out the provisions of and amendments made by this section. Amount specified. For purposes of paragraph, the amount specified in this paragraph is an amount that bears the same ratio to the amount appropriated under paragraph as the number of applicable individuals of the Social Security Act, as added by subsection residing in such state bears to the total number of such individuals residing in all states. F. There are appropriated out of any monies in the Treasury not otherwise appropriated $100 million for fiscal year 2026 for purposes of awarding grants under paragraph. In this subsection, the term state means one of the 50 states in the District of Columbia. 369. Made by this section, there are appropriated out of any one monies in the Treasury not otherwise appropriated to the 2 Secretary of Health and Human Services $50 million for 3 fiscal year 2026 to remain available until expended. SEC 44,142. Modifying cost sharing requirements 5 for certain expansion individuals 6 under the Medicaid program. IG Section 1916 of the Social Security Act is amended 9. In subsection in the matter preceding 10 paragraph by inserting after individuals, and 13. By adding at the end the following new sub 14 section, 15. C. 17. Beginning October 1st, 2028, 18 the state plan shall provide that in the case of a 19 specified individual, 20 who is eligible under the plan, no enrollment fee, 21 premium or similar charge will be imposed or 22 the plan. 23. Required imposition of cost chart 24. 25. 370. I in general, subject to subparagraph and subsection. In the case of a specified individual, the state plan shall beginning October 1st, 2028, provide for the imposition of such deductions, cost sharing, or similar charges determined appropriate by the state with respect to medical assistance furnished to such an individual. The exclusion of serve. In no case may a deduction, cost sharing, or similar charge be imposed under the state plan with respect to services described in any of subparagraphs through of subsection, or any primary care services, mental health care services, or substance use disorder services furnished to a specified individual. Item and service limita. I, in general, as provided in subclause, in no case may a deduction, cost sharing, or similar charge imposed under the 371 state plan with respect to an item or service furnished to a specified individual exceed $35. Special rules for pre. In no case may a deduction, cost sharing, or similar charge imposed under the state plan with respect to a prescription drug furnished specified individual exceed the limit that would be applicable under paragraph or of section 1916A with respect to such drug and individual if such drug so furnished were subject to cost sharing under such section. Maximum limit on cost share. The total aggregate amount of deductions, cost sharing, or similar charges imposed under the state plan for all individuals in the family may not exceed 5% of the family income of the family involved, as applied on a quarterly or monthly basis. Cases of non-payment. Notwithstanding subsection or any other provision. 372. Of law, a state may permit a provider participating under the state plan to require, as a condition for the provision of care, items or services to a specified individual entitled to medical assistance under this title for such care, items or services, the payment of any deductions, cost sharing, or similar charges authorized to be imposed with respect to such care, items, or services. Nothing in this subparagraph shall be construed as preventing a provider from reducing or waiving the application of such deductions, cost sharing, or similar charges on a case-by-case basis. Specified individual defined. For purposes of this subsection, the term specified individual means an individual who has a family income that exceeds the poverty line, applicable to a family of the size involved, and 373. Minimum essential coverage of the Internal Revenue Code of 1986, and determined in accordance with standards prescribed by the Secretary and regulations to all individuals described in Section 1902. Our required application. Section 1902 of the Social Security Act is amended by inserting and provide for imposition of such deductions, cost sharing, or similar charges for medical assistance furnished to specified individuals of Section 1916, in accordance with paragraph of such section after Section 1916. Non-applicability of alternative cost. Section 1916A of the Social Security Act is amended in the second sentence by striking or and inserting or Part 2 Affordable Care Act, SCC 44201, addressing waste, fraud, and abuse in the ACA exchanges. Seeing as to E periods for e-rolling and Section 1311 of the patient. 374. Protection and Affordable Care Act is one amended, 2. In subsection 3. By striking subparagraph 4. By striking the Secretary, and in 5 inserting the following, 6. In general, the Secretary, 7. By redesignating subparagraphs 8 through as clauses through, respect, 9 Tively, and adjusting the margins accordingly. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. clause as so redesignated by striking periods, as determined by the Secretary for calendar years after the initial enrollment period, and inserting the following periods for plans offered in the individual market for enrollment for plan years beginning before January 1st, 2026, as determined by the Secretary. For enrollment for plan years beginning on or after January 1st, 2026, beginning on November 1st, and ending on December 15th of the preceding calendar year. 375. In clause as so redesignated by one inserting subject to subparagraph before two special enrollment periods specified, and 3. By adding at the end the following new 4 subparagraph 5. Prohibited special enrollment. With respect to plan years beginning on or after January 1st, 2026, the Secretary may not require an exchange to provide for a special enrollment period for an individual on the basis of the relationship of the income of such individual to the poverty line, other than a special enrollment period based on a change in circumstances or the occurrence of a specific event. In subsection, by adding at the end the following new paragraphs. Prohibited enrollment periods. An exchange may not provide for, with respect to enrollment for plan years beginning on or after January 1st, 2026, an annual open enrollment period other than the period described in subparagraph of subsection 376. A special enrollment period described in subparagraph of such subsection. Verification of eligibility for special enrollment periods. With respect to enrollment for plan years beginning on or after January 1st, 2026, an exchange shall verify that each individual seeking to enroll in a qualified health plan offered by the exchange during a special enrollment period selected under subparagraph is eligible to enroll during such special enrollment period prior to enrolling such individual in such plan. Selected special enrollment. For purposes of subparagraph, an exchange shall select one or more special enrollment periods for a plan year with respect to which such exchange shall conduct the verification required under subparagraph such that the exchange conducts such verification for not less than 75% of all individuals enrolling in a qualified health plan offered by the exchange during any special enrollment period with respect to such plan year. 377. IN General. Section 1411 of the Patient Protection and Affordable Care Act is amended by redesignating subparagraph as subparagraph. By inserting after subparagraph the following new subparagraphs requiring verification of income and family size when tax data. For plan years beginning on or after January 1st, 2026 for purposes of subparagraph, in the case that the exchange requests data from the Secretary of the Treasury regarding an individual's household income and the Secretary of the Treasury does not return such data, such information may not be verified solely on the basis of the attestation of such individual with respect to such household income, and the exchange shall take the actions described in subparagraph 378. Requiring verification of income in the case of certain income dis 2. 3. In general subject to clause 4. For plan years beginning on or after January 5th, 1st, 2026 for purposes of subpara 6 graph, in the case that a specified in 7 income discrepancy described in clause of 8, this subparagraph exists with respect to 9 the information provided by an applicant 10 under subsection. The household in 11 income of such individual shall be treated as 12 inconsistent with information in the 13 records maintained by persons under sub 14 section, or is not verified under sub 15 section, and the exchange shall take 16 the actions described in such subparagraph 17. 18. Specified income discrepancy. For purposes of clause, a specified income discrepancy exists with respect to the information provided by an applicant under subsection if the applicant attests to a projected annual household income. 379. That would qualify such applicant to be an applicable taxpayer under Section 36B of the Internal Revenue Code of 1986 with respect to the taxable year involved. The exchange receives data from the Secretary of the Treasury or other reliable third-party data that indicates that the household income of such applicant is less than the household income that would qualify such applicant to be an applicable taxpayer under such Section 36B with respect to the taxable year involved. Such attested projected annual household income exceeds the income reflected in the data described in subclause by a reasonable threshold established by the exchange and approved by the Secretary. The exchange has not assessed or determined based on the data described in subclause that 380. The household income of the applicant meets the applicable income-based eligibility standard for the Medicaid program under Title VI of the Social Security Act or the State Children's Health Insurance Program under Title XXI of such act. The exclusion of certain individuals ineligible for Medicaid. This subparagraph shall not apply in the case of an applicant who is an alien lawfully present in the United States, who is not eligible for the Medicaid program under Title XX of the Social Security Act by reason of such alien status. Annual requirement to file and rec. 381. I, for plan years beginning on or after January 1st, 2026, in the case of an individual with respect to whom any advance payment of the premium tax credit allowable under Section 36B of the Internal Revenue Code of 1986 was made under this section to the issuer of a qualified health plan for the relevant prior tax year, an advance determination of eligibility for such premium tax credit may not be made under this subsection with respect to such individual and such plan year if the exchange determines, based on information provided by the Secretary of the Treasury, that such individual has not filed an income tax return as required under Section 6011 and 6012 of such code for the relevant prior tax year, or as necessary, has not reconciled of such Section 36B, the advance payment of the premium tax credit made with respect to such individual for such relevant prior tax year. 382. Our relevant prior tax year. For purposes of subparagraph, the term relevant prior tax year means with respect to the advance determination of eligibility made under this subsection with respect to an individual, the taxable year for which tax return data would be used for purposes of verifying the household income and family size of such individual. Preliminary attestation. If an individual subject to subparagraph attests that such individual has fulfilled the requirements to file an income tax return for the relevant prior tax year, as necessary, to reconcile the advance payment of the premium tax credit made respect to such individual for such relevant prior tax year and of such subparagraph. The Secretary may make an initial advance determination of eligibility with respect to such individual and may delay for a reasonable period any determination based on information provided by the Secretary of the Treasury that such individual has not fulfilled such requirements. 383. N. If the Secretary determines that an individual did not meet the requirements described in subparagraph with respect to the relevant prior tax year and notifies the exchange of such determination, the exchange shall comply with the notification requirement described in Section 155.305 of Title 45, Code of Federal Regulations. removing automatic extension of period to resolve income inconsistencies. The Secretary of Health and Human Services shall revise Section 155.315 of Title 45, Code of Federal Regulations, to remove paragraph of such section such that, with respect to enrollment for plan years beginning on or after January 1st, 2026, in the case that an exchange established under Subtitle D of Title I of the Patient Protection and Affordable Care Act provides an individual applying for enrollment in a qualified health plan with a 90-day period to resolve an inconsistency in the application of such individual pursuant to Section 1411 of such act. The exchange may not provide for an automatic extension to such 384 day period on the basis that such individual is required to present satisfactory documentary evidence to verify household income. The Secretary of Health and Human Services shall revise Section 156.140 of Title 45, Code of Federal Regulations, to provide that, for plan years beginning on or after January 1st, 2026, the allowable variation in the actuarial value of a health plan applicable under such section shall be the allowable variation for such plan applicable under such section for plan year 2022. Revise Section 156.200 of Title 45, Code of Federal Regulations, to provide that, for plan years beginning on or after January 1st, 2026, the requirement for a qualified health plan described in such section is that the issuer ensures that each qualified health plan complies with benefit design standards as defined in Section 156.20 of such title, and revise Section 156.400 of Title 45, Code of Federal Regulations, to provide that, for plan years beginning on or after January 1st, 2026, the term de minimis variation for 385, a silver plan variation means a -1 percentage 1 point and plus 1 percentage point allowable actuarial 2 value variation. UPAP4M, Section 1302 of the Patient Protection and Affordable Care Act 6 is amended 7 by striking for purposes and inserting 8I for purposes, by adding at the end the following new sub-10 paragraph 11. UP date to methodology. For 12 calendar years beginning with 2026, the pre-13 MIAM adjustment percentage under this para 14 graph for such calendar year shall be deter 15 mine consistent with the methodology. Pub 16 list in the Federal Register on April 25th, 2019. Eliminating the F$ and G19TA applicable to E20E. The Secretary of Health and Human 21 Services shall revise Section 155.400 of Title 45, Code 22 of Federal Regulations to 23 eliminate for plan years beginning on or after January 24th, 2026, the gross premium percentage base premium 25. 386. Payment threshold policy described in paragraph of 1 such section and the fixed dollar premium payment 2 threshold policy described in paragraph of such section. Side bequests. The Secretary of Health and 7 Human Services shall revise Section 155.335 of Title 45. 8 Code of Federal Regulations 9 to remove paragraph of such section such that, with 10 respect to re-enrollments for plan years beginning on or 11 after January 1st, 2026, an exchange established under 12 Subtitle D of Title I of the Patient Protection and Afford 13 Able Care Act, 42 U.S.C. 18021 at C. May not re-enroll 14 an individual who was enrolled in a bronze level qualified 15 health plan in a silver level qualified health plan and described in 17-1302 of such act unless otherwise permitted under 18. Section 155.335 of Title 45, Code of Federal Regula 19 chins, as in effect on the day before the date of the enact 20 ment of this section. 21. RA Payments P22 TCR 23. Section 1412 of the Patient Protection 24 and Affordable Care Act is amended 25. 387. In subsection by inserting subject 1 to subsection after qualified health 2 plans and 3. In subsection 4. In subparagraph by striking 5 then inserting subject to subparagraph 6. Then 7. By adding at the end the following new 8 subparagraph 9. R. Reduction in advance payment 10 for specified re-enrolled individuals. 11. I. The amount of 12 advance payment made under subpara 13 graph to reduce the premium payable 14 for a qualified health plan that provides 15 coverage to a specified re-enrolled individual 16 for an applicable month shall be in 17 amount equal to the amount that would 18 otherwise be made under such subpara 19 graph reduced by $5. 2223. D in this subparagraph. 388. Applicable month. The term applicable month means, with respect to a specified re-enrolled individual, any month during a plan year beginning on or after January 1st, 27, January 1st, 2026, if prior to the first day of such month, such individual has failed to confirm or update such information as is necessary to redetermine the eligibility of such individual for such plan year pursuant to Section 1411. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Specified re-enrolled. The term specified re-enrolled individual means an individual who is re-enrolled in a qualified health plan and with respect to whom the advance payment made under subparagraph would, without application of any reduction under this subparagraph, reduce the premium payable for a qualified health plan that 389 provides coverage to such an individual to $0. BC over G procedures and HB POE. I in general. Section 1302 of the Patient Protection Affordable Care Act is amended by adding at the end the following new subparagraph. Gender transition pros for plan years beginning on or after January 1st, 2027. The essential health benefits defined pursuant to paragraph may not include items and services furnished for a gender transition procedure. Gender transition procedure. Section 1304 of the Patient Protection and Affordable Care Act is amended by adding at the end the following new subsection. I in this title, except as provided in paragraph, the term gender transition procedure means, with respect to an individual, any of the following when performed for the purpose of intentionally changing the body of such individual. 390. To no longer correspond to the individual's free sex. 4. Performing any surgery including 5. Castration 6. Sterilization 7. Orchiectomy 8. Scrotoplasty 9. Vasectomy 10. Tubal ligation 11. Hysterectomy 12. Oophorectomy 13. Ovariectomy 14. Metoidioplasty 15. Clitoroplasty 16. Reconstruction of the fixed part 17 of the urethra with or without a 18. Metoidioplasty or a phalloplasty 19. Penectomy 20. Phalloplasty 21. Vaginoplasty 22. Vaginectomy 23. Vulvoplasty 24. Reduction thyrochondroplasty 25. 391. Chondrolaryngoplasty 1. Mastectomy and 2. Any plastic, cosmetic, or aesthetic surgery that feminizes or masculinizes the facial or other body features of an individual. Any placement of chest implants to 7 create feminine breasts, or any placement of 8 erection or testicular prostheses. Any placement of fat or artificial implants in the gluteal region. 11. Administering, prescribing, or dispensing to an individual medications, include 13ing, 14. Gonadotropin releasing hormone 15 analogs or other puberty block, 16ing drugs to stop or delay normal puberty. 17 and 18 testosterone, estrogen, or other 19 androgens to an individual at doses that 20 are superphysiologic, then would normally 21 be produced endogenously in a healthy and 22 individual of the same age and sex. 23. E paragraph shall not 24 apply to the following. 25. 392. Puberty suppression or blocking pre-1 scription drugs for the purpose of normalizing to puberty for an individual experiencing pre-3 precocious puberty. Medically necessary procedures or 5 treatments to correct for 6. A medically verifiable disorder of 7 sex development, including 8. 46 XX chromosomes with 9 viralization, 1046 XY chromosomes with 11 under viralization, and 12 both ovarian and testicular, 13 tissue, 14, 15, 16, 17, 18, 19. Sex chromosome structure, sex steroid hormone production, or sex hormone action, if determined to be abnormal by a physician through genetic or biochemical testing. Infection, disease, injury, or disorder caused or exacerbated by a previous procedure described in paragraph, or a physical disorder, physical injury, or physical illness that would, as certified by a physician, place the individual in imminent. 393. Danger of death or impairment of a major 1 bodily function unless the procedure is per 2 formed, not including procedures per 3 formed for the alleviation of mental distress, or 5. Procedures to restore or reconstruct the body of the individual in order to correspond to the individual's sex after 1 or more previous procedures described in paragraph, which may include the removal of a pseudophallus or breast augmentation. For purposes of this subsection, the term sex means either male or female, as biologically determined and defined by subparagraph. And subparagraph F. The term female means an individual who naturally has, had, will have, or would have, but for a developmental or genetic anomaly or historical accident, the reproductive system that at some point produces, transports, and utilizes eggs for fertilization. 394. Anomaly or historical accident, the reproductive system that at some point produces, transports, and utilizes sperm for fertilization. C. I in general. Section 1312 of the Patient Protection and Affordable Care Act is amended by adding at the end the following new paragraph. Clarification of lawful presence. In this title, the term alien lawfully present in the United States does not include an alien granted deferred action under the Deferred Action for Childhood Arrivals process, pursuant to the memorandum of the Department of Homeland Security entitled Exercising Prosecutorial Discretion with Respect to Individuals Who Came to the United States as Children, issued on June 15, 2012. C. Sharing. Section 1402 of the Patient Protection and Affordable Care Act is amended by adding at the end the following new sentence. For purposes of this section, an individual shall not be treated as lawfully present if the individual is an alien granted deferred action under the Deferred Action 395 for Childhood Arrivals process, pursuant to the memorandum of the Department of Homeland Security entitled Exercising Prosecutorial Discretion with respect to individuals who came to the United States as children, issued on June 15, 2012. PA and Prohibition. Section 1412 of the Patient Protection and Affordable Care Act is amended by adding at the end the following new sentence. For purposes of the previous sentence, an individual shall not be treated as lawfully present if the individual is an alien granted deferred action under the Deferred Action for Childhood Arrivals process, pursuant to the memorandum of the Department of Homeland Security, written entitled Exercising Prosecutorial Discretion with Respect to Individuals Who Came to the United States as Children, issued on June 15, 2012. The amendments made by this section shall apply with respect to plan years beginning on or after January 1st, 2026. AI Remittance A 396. IN General. Section 2702 of the Public Health Service Act is amended by adding at the end the following new subsection. In general, a health insurance issuer offering individual health insurance coverage may, to the extent allowed under state law, deny such coverage in the case of an individual who owes any amount for premiums for individual health insurance coverage offered by such issuer, as such issuer, in which such individual was previously enrolled. Attribution of initial premium payment to owed amount. A health insurance issuer offering individual health insurance coverage may, in the case of an individual described in paragraph and to the extent allowed under state law, attribute the initial premium payment for such coverage applicable to such individual to the amount owed by such individual for premiums for individual health insurance coverage offered by such issuer in which such individual was previously enrolled. 397. Controlled group defined. For purposes of this subsection, the term controlled group means a group of two or more persons that is treated as a single employer under Section 52, 414, or 414 of the Internal Revenue Code of 1986. 1, 2, 3, 4, 5, 6. Effective date. The amendment made 7 by paragraph shall apply with respect to plan 8 years beginning on or after January 1st, 2026. 9 Part 3 Improving Americans' Access to 10 Care 11 SEC. 440.1 Expanding and clarifying the exclusion 1212 for orphan drugs under the Drug 13 Price Negotiation Program. 14. IG Section 1192 of the Social Save 15 Security Act is amended. 16. In paragraph in the matter preceding 17 subparagraph by striking and insert 18 through 19. In paragraph 20. By striking only one rare disease or 21 condition and inserting one or more rare 22 eases or conditions, and 23. By striking such disease or condition 24 and inserting one or more rare diseases or 25. 398. Treatment of former orphan. In the case of a drug or biological product that, as of the date of the approval or licensure of such drug or biological product, is a drug or biological product described in paragraph or shall apply as if the reference to the date of such approval or the date of such licensure, respectively, were instead a reference to the first day after the date of such approval, for which such drug is not a drug described in paragraph, or the first day after the date of such licensure for which such biological product is not a biological product described in paragraph, respectively. A. The amendments made by subsection shall apply with respect to initial price applicability years of the Social Security Act, beginning on or after January 1st, 2028. 399. SEC 44,302. Streamlined enrollment process for L1 eligible out-of-state providers under 2 Medicaid and CHIP. In G, Section 1902 of the Social Security Act is amended by adding 5 at the end, the following new paragraph. 6. Streamlined enrollment process. 7. For eligible out. The state 9. Adopts and implements a process. 10. To allow an eligible out-of-state provider to 11 enroll under the state plan to furnish items and services to 13 or order prescribe refer or certify LGI 14 ability for items and services for qualifying 15 individuals without the imposition of 16 screening or enrollment requirements by 17 such state that exceed the minimum net 18 necessary for such state to provide payment. 19 to an eligible out-of-state provider under 20 such state plan. 21 such as the provider's name and national. 22 provider identifier. And 24 provides that an eligible out of 25 state provider that enrolls as a Partici 26. 400. Paiding provider in the state plan through such process 2 shall be so enrolled for a 5-year period. 3 lest the provider is terminated or excluded 4 from participation during such period. 5. D in this paragraph 6, 7, 8, 9, 10. That is located in any other 11 state. 12 that 13 was determined by the 14 secretary to have a limited risk. 15 of fraud, waste, and abuse for 16 purposes of determining the level 17 of screening to be conducted. 18 under section 1866 has 19 been so screened under such sec 20 shin 1866 and is enrolled in 21 the Medicare program under title 22 as X fee or 23, 24, 25. Eligible out-state pro. The term eligible out-of-state provider means with respect to a state a provider was determined by the state agency administering or 401. Providing the administration of the state plan of such other state to have a limited risk of fraud, waste, and abuse for purposes of determining the level of screening to be conducted under paragraph of this subsection has been so screened under such paragraph and is enrolled under such state plan. 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. That has not been excluded from participation in any federal health care program pursuant to section 1128 or 1128A. Excluded from participation in the state plan pursuant to Part 1002 of Title 42, Code of Federal Regulations or state law, or 402.
Welcome to Executive Order Watch.
The immigrants have arrived.
I know. I have the package.